The patient's demands, women with vaginal atrophy, sexual dysfunction, vaginal laxity and incontinence, all of them can be managed with different kind of treatment options these days. The gold standard, as I said, remains the surgery, but surgery has the highest efficacy, can have definitely the highest cost, there's no doubt about it. Versatility, you can do anything, you can titrate the results, and the only problem is the downtime. After a vaginal surgery, the patient cannot have vaginal intercourse for at least 6 weeks, if not 8. Now, there are a lot of patients who don't want to be on abstinence or celibacy for 8 weeks. So they say, no, I don't want to get it now, I'll see it later. Local hormone therapy and the fillers, let it be natural or artificial like the hyaluronic acid, they are also no options, and they have a chip in the roll. But then the energy-based devices have been a clear favorite. There are two reasons for it. Number one, the learning curve is zero. Zero. Today, you get trained on an energy-based device, you will start using it tomorrow. It's like using a phone, right? You know how to, if you buy a phone, you know how to use it. You end up knowing how to use it. There are no two options about it. So, if someone tells you that we'll teach you how to use an energy-based device, I think that's the job of industry. That's not my job. My job is to teach you how to select the right patients, how to do the right procedure, what to do, what not to do, what energy to use, what results to expect, and how to combine treatments to give patients results. Please understand, we don't do a beauty practice. We don't do any aesthetic practice, right? The word itself denotes beauty. We do a practice which is approved by the National Medical Commission, and that is the reason why we don't pay GST when we do this practice. There is a huge difference why we don't pay GST when we do cosmetic gynecology practice, because it's an approved medical practice. Had it not been approved, you would have ended up paying a GST for every procedure of cosmetic gynecology, just like a plastic surgeon or a dermatologist pay when they do any such aesthetic procedures. Now, energy-based devices have a role without surgery, with surgery, and before surgery. I heard of someone telling that do not even think of doing a surgery to a patient where you have used a laser in the vagina. 100% true if you use an ablative laser. Because you have ablated the vagina, you have fibrosed the vagina, and then definitely from there you will get the planes. But if you have used a non-ablative device, if you have used anything which actually works in the vagina, actually you end up having better planes. So many times when we get now patients who are perimenopausal or who got very thin mucosa, vaginal mucosa, and we want to have better surgical outcomes and better surgical planes, we end up using 1 or 2 sessions of energy-based devices even before surgery. Because most of these days our patients end up into combination treatments which are combined with surgery and non-surgical modalities. So definitely we have to see that what we're using before, what we'll use after, and it is a subspeciality where there is not one size fits all. Every separate patient has a separate treatment plan. You just cannot say this plus this is equal to this. No, it does not. Every patient deserves an independent treatment plan. I will not go into the depths of different energy-based devices, but just because someone else is going to be covering the energy-based devices, but I can tell you from our massive experience which we have gathered over years by using each and every energy-based device at our own hands. We run actively, we are running centers, we've got close to 70 different energy-based devices spread across